Chapter 2. The woman tried to open her eyes and grimaced against the pain. Where am I? Her voice sounded groggy and far away, and her head throbbed. After a few tries, she managed to get her right eye open, but the left didn't seem to work. Fire Beach Hospital. I'm Dr. Cavanaugh. How are you feeling? She searched for the source of the voice and found a handsome man in a white coat at the foot of her bed. His coppery hair was combed back, and his face sported a neatly trimmed beard and mustache. He held a clipboard in his hands. A doctor? Was she in a hospital? The woman groaned and closed her eyes as another wave of pain, followed by a wave of nausea, hit. When it passed, and she was sure she wouldn't vomit when she opened her mouth, she answered his question. Like I've been hit by a train. She attempted to raise her hand to touch her head, but cords and pain made her lay it back down. Close, he nodded and gave her a small smile. We heard it was a black Ford truck. The police are looking for them now, but can you remember anything else? She tried to focus. I was in an accident? She felt like she should remember that, and there was this tiny spot in her brain that felt like a memory, but it was fuzzy and far away. You were. Banged you up pretty badly. Your left eye is swollen shut, which is why you can't open it right now. You have a pretty deep contusion on your head, and your right foot was broken, but it looked a lot worse initially. Thankfully, you have no internal bleeding, but you were unconscious for a while. Can you remember anything about the accident? Fear. A feeling of fear crackled in the air. She remembered fear coursing through her body and bright lights. I think someone was after me. He raised an eyebrow as he marked something on his clipboard. What makes you think that? I don't know. Her words sounded desperate and angry in her ears. I just feel like I was running from something, and someone was chasing me. Okay, we'll come back to that later. She could tell from his voice that he didn't believe her, but she knew what she felt. She didn't remember the details, but the lingering caress of fear didn't dissipate. Let's start with something easier. Can you tell me your name? What kind of stupid question was that? Certainly she knew her name. It was... Suddenly her right eye shot open, and her heart thundered harder in her chest. The caress of fear shifted into a full embrace that covered her body. She caught the doctor's gaze and forced the fearful words out. I don't remember my name. Is that normal? His jaw tightened, just the slightest twitch near his chin, but the movement was brief, and she wondered if she had just imagined it. It can happen in cases like this. You hit your head pretty hard, and you had a concussion, which can cause some memory loss. The CT showed some swelling, so we'll continue to monitor it. It will come back, though, won't it? Anxiety joined the fear coursing through her body. She couldn't have lost her memory. I've seen patients regain some memory, depending on how severe the concussion was. Some memory? I can't lose any of my memory. A desperate fear ravaged her and colored her voice. What would she do if she couldn't remember her life? You have to do something to get it back. He chuckled softly and shook his head. There's no trick I can do if that's what you're looking for. But it does help if you don't stress yourself out. Not stress myself out. Her voice took on a sharp edge. That's easy for you to say, but I don't even know who I am at the moment, and there are clearly people out to get me. So not stressing is not really an option. His smile faded and a cool expression covered his face. I know you're scared, but I need you to stay calm. Wait, what about identification? Did I have a purse? I feel like I don't go anywhere without a purse. She was desperate, but maybe if she saw her name, it would all come flooding back. I'll check with Detective Graves, who is probably the one handling your case. If there was a purse, we'll get it to you. Now, why don't you relax and let me examine you? The woman tried to relax, but her brain continued to spin. Surely someone was missing her. Was she married? Did she have kids? Her gaze traveled to her left hand, but there was no ring. Had they removed her jewelry? Did I have anything when I came in? Any jewelry? I'm not sure, but I'll check. He shined a light in her eyes. How is the pain in your head? Awful. It feels like someone's beating a gong inside my brain. She paused for a minute. Those words felt familiar, as if she'd heard them before. Dr. Cavanaugh chuckled. Well, that's a saying I haven't heard before. So I bet you're not from around here. She wasn't even sure where here was at the moment, but before she could ask, he continued, "How about your feet?" She closed her eyes and tried to focus on her feet, but there was so much pain coursing through her body that she couldn't be sure where it was coming from. "All I feel is pain. Can't you give me something for the pain?" "I have you on an IV delivering pain medicine. I can't give you any more, but the pain will lessen as you heal. Now, can you feel this?" She blew out a frustrated breath and concentrated on her foot. Perhaps she felt something, but she wasn't sure. Maybe?" She glanced up at him. From the expression on his face, that wasn't the answer he wanted. "Is it bad?" "It's not what I would like, but it might be that the pain you are feeling is still affecting your movement. We'll give it another few days." He continued the exam, pressing gently on her stomach and her thighs before scanning both her arms. When he appeared satisfied, he stepped back. "Do you feel up to eating? I can have Valerie bring you some food." Eating? How could she think about eating? Her world had just been turned upside down. But he must have taken her lack of response as a yes as he continued his spiel. "If you would like to watch TV, the remote is here." He picked it up and waved it before setting it back beside her. "And here on the side of the bed is the call button. If you need a nurse, you hit that button. This button here you can hit if you need more medicine, but it will max out at a certain level. I'm afraid we can't take all the pain away. I'll be back to check on you before I leave for the day." Anxiety clutched at her heart, and she heard it in her voice. "You mean you aren't going to be monitoring me directly?" "I'm afraid I have other patients that I also have to check on, but I will look back on you before I leave." She watched him walk out the door and tried to keep her tears in check, but the silence of the room pressed in on her. Except for the beeping of some monitor, she was alone, with no idea of who she was or when she might remember. Brody sighed as he exited the woman's room. He had expected her to be demanding from the persona he had created of her, but he hadn't expected the memory loss. While some patients did regain their memories, many didn't, and he certainly couldn't release her until at least some of her memory returned. Plus, the loss of sensation in her feet bothered him. He had seen no blackening of her skin, which was hopeful. It meant her foot was still getting blood flow, but that didn't mean she would be able to walk on it again if she didn't get sensation back. "I was hoping I would find you here." Brody looked up to see Detective Jordan Graves and a young-looking woman striding his direction. Jordan held a mangled object in his hand. "Dr. Cavanaugh, this is my partner, Al Parker. The woman had a phone in the car," he said, holding up the object, "but no wallet. Is she awake yet?" "She is, but she doesn't remember much, not even her name." The woman, Al, blinked at him. "Is that normal? Will she get it back?" Brody shrugged and picked up the next patient info sheet. "I don't know. She hit her head pretty hard and sustained a concussion, but the CT didn't show any lasting damage, although it did show swelling. My guess is that she will get at least some back, but I can't give you a timeline." "Is she able to talk? Can we ask her questions?" Jordan pressed. "She is capable of speaking, but don't push her too hard. Rest is important for her right now. And again, I don't think she remembers much, although she does think someone was after her." "She does. What did she say?" "Not much, just that she remembered being afraid and thought someone was after her. I was about to refer her to psych for an examination." Jordan's jaw clenched, and he exchanged a glance with Al. "Hold off on that for a while, will you? She might be right. We found no brake marks on the road, and our witness said the truck didn't even try to stop. My gut says this might not have been an accident, and we're determined to find out who hit her and why. Which room is she in?" "Room 6. Brody pointed behind him and watched the two detectives walk away. He felt his view of the woman shifting. She might be a bit challenging, but why would someone be after her? He found himself curious about her. Maybe it was because he had been one of the first responders on the scene and ridden with her in the ambulance. Maybe it was because she seemed so vulnerable, both with her injuries and with her memory loss. Whatever the reason, he needed to think less about the Jane Doe in room 6 and more about his job before he made a mistake.